This aged care home in Melbourne's western suburbs, like thousands around the country, has been in virtual lockdown for months.
And I was a bit worried about her being in there. They assured that, they're doing everything possible to keep it out. So they haven't spoke to Bugs or anyone, only me.
Cheryl Whittle hasn't been able to visit her 77-year-old mum Sandra Powell for fear she or other visitors might infect residents. But the coronavirus eventually made its way into the Mequicare nursing home. According to Victorian authorities, it grew from a few infections on July 29 to more than 50, 41 of them residents, including Cheryl's mother.
I spoke to Mum via FaceTime, and she was in bed, hadn't been showered, hadn't been fed, didn't have a drink. I was a bit upset. I don't know when it got in there, how it got in there, why didn't we get a chance to get Mum out of there before she got it?
7:30 has seen emails sent by Mequicare to families saying 3 residents have died. But Mequicare didn't answer our questions about the number of coronavirus infections and deaths. Coronavirus has infiltrated 1 in 4 Melbourne nursing homes. Latest figures show there have been over 2,300 infections in Melbourne aged care homes, 1,000 staff and almost 1,300 residents. That's a 14-fold increase in just 1 month. Across the country, nursing home residents account for almost 60% of coronavirus deaths, amongst the worst in the world.
It shouldn't be a shock to anybody that the coronavirus is ravaging through these aged care homes. They were critically understaffed and have been for years.
Jason Ward is a tax expert who spent years investigating how the aged care industry spends almost $20 billion a year in taxpayer funds. Nursing homes were given hundreds of millions of dollars extra to prepare for the pandemic. But he says there was no obligation to spend it on more staff or protective equipment.
I think the major findings is a complete lack of transparency and a lack of accountability.
7:30 has received photos that appear to show bags of used protective gear and other rubbish piling up outside another Melbourne nursing home. The provider said this was due to unprecedented demand for waste collection during the pandemic, which has now been rectified.
While these providers have gotten additional money, there's no evidence that they've actually spent that money in a way that's been effective in preventing the spread of this disease and unnecessary deaths.
The residents wandering around without masks were a concern. I tried to avoid them, but there were occasions when I couldn't avoid them because I had to care for them, and I was coughed on.
Rhonda O'Brien is one of more than 1,000 aged care workers who have coronavirus. She says it's unfair that staff are being blamed for spreading the virus when there's no mandatory training in infection control.
Some of the staff weren't sure about when to change gloves, for instance, and you found them going from room to room with the same pair of gloves on. So, that was a breach.
Rhonda worked at another Melbourne nursing home where 2 residents became infected a month ago. Since then, more than 50 residents and staff have caught the virus.
It is pretty disgusting to see residents dying and workers suffering, and public funding with no transparency and no public accountability. It really has to change.
Last month, amid growing numbers of aged care infections in Victoria, the Federal Health Minister defended the industry.
So I think aged care around the country has been immensely prepared.
This week, the Royal Commission into Aged Care heard a different story.
The evidence will reveal that neither the Commonwealth Department of Health nor the aged care regulator developed a COVID-19 plan specifically for the aged care sector.
The government has refused to publicly name the 125 nursing homes in Victoria with COVID outbreaks, citing reputational issues for the owners.
I think on balance the public will require that those aged care facilities are named. And then the problem...
Liberal Senator Concetta Fierravanti-Wells is a former shadow minister for aged care. She's speaking out against her own government's lack of reform.
This is a sector that had major and has major issues. It's been known for a long time. We've had review upon review. We went to the electorate with a good policy and we promised reform. This was longed for reform, and regrettably that longed for reform was not enacted after the 2013 election. It doesn't surprise me to see what is happening today.
I've been in this room basically for 28 days, mainly staring out the window and watching people deliver food for me.
Like thousands of other aged care staff, Rhonda O'Brien works shifts at different nursing homes across Melbourne.
I feel badly done by, to be honest, because I worked 5 shifts at a facility in Melbourne. I contracted COVID. I don't know what this virus might mean for my future health.
As an emergency measure to stop the spread of the virus, the federal government is paying aged care providers in Melbourne until September to keep staff working at just one home. Today, South Australia brought in similar restrictions, but the Healthcare Services Union wants the same rule across the whole country.
I think over the coming weeks and potentially months, we're going to see things get worse. If we prevent people from working 2 or 3 jobs, we can get people working at one workplace and all workers will be safe.
For the thousands at the centre of this crisis, there's no end in sight.
No, I can't sleep. I go without sleep for a few days and then I'm exhausted, I have to sleep. Feel empty because you can't go in there and be with them and give them a cuddle.
I think it must be hideous to die with a stranger holding your hand. But the families are the ones that are going to be traumatised this for the rest of their lives.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.